So the process we undergo when we're trying to figure out if a patient is a candidate for dental implants, we have to think about where they're coming from. Are they a patient that has dentures currently and they want to support those dentures, or they're tired of those dentures sliding and flopping around? Or is it a patient with rapidly failing dentition? They have decay, they know they have dental problems, and they're concerned about certain areas or quadrants within their mouth. So we start with a comprehensive exam, we do a full case workup, and then we just have a conversation about what their options are. So implants have been around for quite some time, and they've only gotten better and better. And the types of materials, it's basically, for the most part, a titanium screw. However, the difference is the quality of the titanium, the way it's manufactured, the quality controls used, and the surfaces and how they're created. And our two implant companies that we primarily partner with, Straumann as well as Nobel, they have amazing implant surfaces. The quality control is the best available, and we feel really comfortable in using those two brands. The best thing about implants in this day and age is the predictability, where you used to have to do crowns with bridge work or partials that relied on other teeth to hold them in place. That's partial functionality, in my opinion. What's nice about implants is that you can actually restore full functionality to patients with missing teeth, with missing body parts, so to speak. They have edentulous sites, there's no function there, and you can recreate function with implants in the same way that you can with teeth.